Hello and welcome back to my channel. Today we're going to talk about a topic that many people struggle with but don't always feel comfortable discussing: constipation. If you've ever experienced difficulty passing stool, infrequent bowel movements, or discomfort when using the bathroom, you're not alone. Constipation is one of the most common digestive complaints, affecting people of all ages. In this video, I'll walk you through the causes of constipation, the different types, and most importantly, how you can manage it effectively. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Constipation occurs when bowel movements become infrequent or difficult to pass. While the definition can vary from person to person, it's generally considered constipation when you have fewer than 3 bowel movements per week, or if passing stool becomes painful or requires excessive straining. The stool may be hard, dry, or lumpy, making the experience uncomfortable and in some cases leading to complications like hemorrhoids. To understand constipation, we first need to look at what causes it. One of the most common reasons is inadequate fiber intake. Fiber plays a crucial role in adding bulk to stool and helping it move through the intestine smoothly. When a diet is low in fiber, stools can become hard and difficult to pass. Not drinking enough water can also contribute to constipation, as dehydration makes stools dry and compact. A sedentary lifestyle is another major factor. Physical activity stimulates intestinal contractions, helping waste move through the digestive tract. When people don't move enough, whether due to lifestyle choices, medical conditions, or aging, their digestion can slow down. This is why constipation is particularly common in older adults and individuals who are confined to a bed. Changes in routine can also impact bowel habits. Traveling, switching diets, or altering meal times can disrupt the body's normal rhythm, leading to temporary constipation. Stress and anxiety also play a role, as the gut and brain are closely connected. Emotional stress can slow down digestion and make bowel movements less frequent. Certain medications can cause constipation as a side effect. Opioid pain relievers, some antidepressants, iron supplements, calcium channel blockers, and even overuse of laxatives can all lead to chronic constipation. In some cases, medical conditions like hypothyroidism, diabetes, irritable bowel syndrome, or neurological disorders such as Parkinson's disease and multiple sclerosis can contribute to difficulty with bowel movements. Now that we understand the causes, let's talk about the different types of constipation. Not all constipation is the same, and recognizing the type you have can help guide the best treatment approach. The first type is primary or functional constipation, which is not caused by an underlying medical condition, but rather by lifestyle factors. This includes slow transit constipation, where the movement of stool through the intestines is sluggish. Some people naturally have a slower digestive process, which can make them more prone to constipation. Another form of primary constipation is pelvic floor dysfunction, where the muscles involved in bowel movements don't work properly. Some individuals may have difficulty coordinating these muscles, making it harder to pass stool even when the urge is there. This condition often requires physical therapy or biofeedback training to retrain the muscles for proper function. The second major category is secondary constipation, which is linked to underlying medical condition or medication use. In these cases, treating the root cause, whether it's adjusting medications, managing a health condition, or addressing nerve or hormone-related issues, can help relieve constipation. So, how do we manage constipation effectively? The first and most important step is making dietary changes. Increasing fiber intake is one of the simplest and most effective ways to promote regular bowel movements. Fiber is found in fruits, vegetables, whole grains, and legumes. Foods like apples, pears, berries, oats, beans, lentils, and leafy greens are particularly good choices. Aim for at least 25 to 30 grams of fiber per day to help soften stool and keep things moving. Hydration is just as crucial. Drinking plenty of water ensures that the fiber you consume can do its job properly. Without enough fluids, fiber can actually worsen constipation by making the stool even harder. Herbal teas and clear broths can also help keep the digestive system hydrated. Regular physical activity plays a significant role in maintaining a healthy digestive system. Exercise helps stimulate the natural contractions of the intestines, making it easier for waste to move through the colon. Even something as simple as a daily walk can make a noticeable difference. If you have a sedentary lifestyle, incorporating more movement into your routine can greatly improve bowel regularity. Another important yet often overlooked aspect of bowel health is proper toilet posture. Sitting in a squatting position with your knees slightly elevated above your hips can make bowel movements easier and more efficient. This position helps straighten the rectum, allowing stool to pass with less effort. Using a small footstool while sitting on the toilet can mimic this natural squatting posture and make a big difference for people who struggle with constipation. For some individuals, dietary and lifestyle changes may not be enough, and additional treatments may be necessary. Over-the-counter laxatives can be helpful when used appropriately, but they should not be relied upon for long-term use. There are different types of laxatives, including bulk-forming fiber supplements like psyllium, stool softeners that add moisture to stool, osmotic laxatives that draw water into the intestines, and stimulant laxatives that can help trigger bowel contractions. It's always best to consult a healthcare provider before using laxatives regularly, as overuse can lead to dependence and worsen constipation over time. If constipation persists despite lifestyle changes and occasional use of laxatives, it's important to seek medical advice. Chronic constipation can sometimes be a sign of an underlying health condition that requires further evaluation. In some cases, diagnostic tests such as blood work, imaging studies, or a colonoscopy may be necessary to rule out more serious causes like bowel obstruction or colorectal disease. For individuals with pelvic floor dysfunction, specialized treatments such as biofeedback therapy can help retrain the muscles responsible for bowel movements. This therapy involves working with a specialist who uses sensors to provide real-time feedback, helping patients learn how to coordinate their muscles properly. So constipation is a common condition that can be caused by diet, lifestyle, medications, or underlying health issues. There are different types of constipation, including functional constipation and constipation related to medical conditions. Managing it effectively involves increasing fiber intake, staying hydrated, exercising regularly, and using proper toilet posture. When necessary, medications or specialized therapies may be needed, but long-term reliance on laxatives should be avoided. If you experience frequent or severe constipation, it's always best to consult a healthcare professional to determine the underlying cause and find the best treatment plan for you. Thank you for watching. I hope this video has given you a better understanding of constipation and how to manage it. If you found this information helpful, don't forget to like, subscribe, and leave a comment with any questions or topics you'd like cover in future videos. As always, take care of yourself and make the most of your day.